Hey, good afternoon. We're ready to rock and roll here in our Social Services Subcommittee. I see, can I have Senator Rome, because she has one bill, and Senator Favole, you have two, and she can go really quick. Yay. So Senator Rome.
Madam Chair, my 2017 classmate and all, good to see you again. Welcome. It's good to see all of my former colleagues and a couple new faces as well. Welcome to the House of Delegates. Anyways, SB 320, this would direct the Department of Health to provide information to food banks in the Commonwealth on the Special Supplemental Nutrition Program for Women's Infants and Children, or WIC. This bill will ensure that all individuals who utilize these food banks know of their opportunities and potential eligibility for this program. We also worked it out with Senator Probst to make sure that we had no fiscal impact to the Commonwealth. So what we did is we included a couple amendments here so that we had a delayed enactment of July 1, 2025. And we also made sure that the Department of Health would pursue strategies to work and basically create public-private partnerships or anything else to ensure that they are finding any resources that are available away from the general fund. With that, Madam Chair, I'm happy to take any questions.
Thank you, Senator Rome. So lovely to be able to call you Senator. Are there any questions from my colleagues on the committee about Senate Bill 320? No? Do you have folks who would like to speak in support of the bill?
Madam Chair, members of the committee, Emily Moore with Voices for Virginia's Children. We thank the patron for bringing this forward and support the bill.
Good afternoon, Chair and members of the subcommittee. My name is Cassie Edner. I'm the Public Benefits Attorney at Virginia Poverty Law Center, and we thank the patron for bringing this bill, and we support it. Thank you.
Thank you so much. Are there any folks here to speak in opposition to this bill? All right. I heard you say that you worked hard so that there would not be a fiscal impact, but we still got a letter directing this bill to appropriations. So if we are going to report out, we need to refer it to appropriations. All right, it's been moved and properly seconded to report Senate Bill 320 and refer to appropriations. Madam Clerk, if you can open the roll, please vote. Okay, great. Senator Rome, your bill, Senate Bill 320, passes our committee by a vote of 6-0. Thank you so much.
Chair, thank you, members of the subcommittee.
All right, thank you. Senator Favole.
Thank you, Madam Chair and members of the committee. I have two bills before you. Senate Bill 43 is the bill I would ask you to draw your attention to first. What this bill does is it sets up a helpline at the Disability Law Center, which is our statutorily designated agency to provide oversight for services to those with disabilities in Virginia. It does have a fiscal impact, but it did pass the Senate 38-0. There's no House companion. This came to me from the members of the disability community who seem to have a difficult time sometimes navigating the different agencies that serve those with disabilities, and that's what this helpline is really for. It is a recommendation of the Disability Advisory Commission as well. So I respectfully ask that you pass the bill, and I'm sure you'll have to re-refer it to Finance or Appropriations.
Thank you so much, Senator Favole, and you've read the tea leaves that if we report out this bill, it will have to be referred to appropriations. Delegate Srinivasan.
Thank you, Madam Chair. Senator, I have a quick question.
Yes.
The 211 line, how is this, or how would that be different from this proposed line?
We call this a helpline, but actually it's intended to resolve questions and to direct the person calling in to the proper agency or program. So it'll provide follow-up as well as the initial conversation.
Thank you. This looks like it's a more enhanced help than...
Delegate Srinivasan, did you have a follow-up comment?
Sorry.
That's okay.
Sorry, Madam Chair. Thank you.
Thank you. Are there any other questions from our committee members? Okay. Are there any folks here to speak in support of the bill? I see Matthew behind you. Senator Favole.
Oh, I'm sorry, Matthew.
You're good. Afternoon, Madam Chair, members of the subcommittee. Matthew Shapiro with Virginia ABSI. To give a little bit more background really quickly on this bill, we find in the disability community there's often a runaround when we are seeking services from different agencies, and we're hoping that this helpline, or whatever we want to call it, will help streamline the process to get people the services they need more quickly. And we strongly support this bill.
Okay, thank you so much. Good afternoon, Colleen.
Hi. Madam Chair, I'm Colleen Miller from the Disability Law Center. Just to echo what Matthew has said, we hear from people in the community just how confusing our disability services are in Virginia. And, if you've got a family member in a group home, is it a waiver group home? Because that's a different place to go to than if it's an assisted living facility, and that's a different place than if it's an unlicensed group home, and it's very hard to figure out how to get your complaints resolved. We think that this will be a good first step to helping members of the community resolve their complaints. So thank you.
Thank you so much. Good afternoon.
Good afternoon, Madam Chair, members of the committee. Ashley Wright, representing the ARC of Virginia. We're very grateful for the work Senator Favola is doing in trying to streamline access to services for people with disabilities. We fully support the bill.
Okay, great. Thank you. Is there anybody here to speak in opposition to this bill? Okay, I don't see anyone. All right, committee members, if we would like, Delegate Gardner.
Oh, no, Madam Chair, I was going to move to report and refer.
All right, so we have a motion to report and refer to appropriations.
Second.
That's been properly seconded. If we can open the roll, Madam Clerk. All right, please vote. Okay, Senator Favola, Senate Bill 43 passes with a vote of 7-0.
Thank you.
Thank you.
Madam Chair, members of the committee. The next bill is Senate Bill 51, and this is a Section 1 bill, and it directs the Department of Aging and Rehabilitation Services to partner with the Department of Education and the Department of Behavioral Health to actually ensure that information to assist parents in understanding the services that are available to our children with disabilities when they transition out of high school and they're searching for post-school activities, whether it be job training or further education. That's always a challenge for our kids who are on IEPs or had even more significant disabilities. So this came out of the Commission on Youth. It was also a recommendation of the Disability Advisory Commission. It is information that DARS should be providing on their website. So we think it's sort of a simple ask. And I don't think, there's no fiscal impact, and it passed the Senate 40-0.
Thank you so much. Are there any questions from our committee members? No? Or is there anybody here to speak in support of this bill? Oh, she's coming back.
I should sit in the front row. Ashley Wright, representing the ARC of Virginia. Good afternoon. We support the bill.
Thank you so much, Ashley. Is there anybody here in opposition to this bill? All right. Senator Favola is correct. There is no fiscal impact, and we do not have to refer this bill to appropriations if we'd like to report it out.
Move to report.
Second.
We have a motion to report that's been properly seconded. Madam Clerk, if you could please open the roll, and if everyone could vote. Wonderful. Senate Bill, please close the roll, and Senate Bill passes our committee by a vote of 7-0. Thanks so much, Senator Favola.
Thank you, Madam Chair, and members of the committee. Have a good day.
Senator Hashmi.
Good afternoon, Madam Chair and members of the committee. I am presenting SB 250. And just a quick summary of the bill. This bill is fairly straightforward. It just clarifies how the current CPT codes for ultrasound and non-stress tests can be billed when the patient is remote and is receiving the same standard of care. So new technologies now offer us the opportunity to provide non-stress tests and ultrasounds in a remote fashion. But we need to also make sure that coverage is provided when patients are using this new technology. As we know, many women in Virginia lack access to adequate maternal care, and this bill is critical because 280,000 women in Virginia currently live in maternity care deserts or counties in which access to maternity health care is limited or absent, and other women who may live closer to care also struggle to access prenatal and appropriate maternal care because they can't take time off from work, or they lack reliable transportation, or they can't find child care, or they're on bed rest. I know I experienced this myself. Both of my pregnancies were extremely high-risk pregnancies, and yet once a week, and my doctor had said the only time I should get out of bed is just to use the bathroom, but once a week I would have to leave my home, drive to my physician, climb stairs in a parking deck, and go and just get my ultrasound. This was 30, 20 years ago. It would have been so wonderful if I could have done that ultrasound right in my home. And now technology allows us to do that. So this bill doesn't actually create any new services, but it increases care compliance for prescribed remote ultrasounds and fetal non-stress tests. And we worked closely with our friends in DMAS, and they indicated that there should be no fiscal impact. The services that are required by the bill are already covered by Medicaid, and thus there is no significant fiscal impact that would be added on. And that's the bill, Madam Chair.
Thank you so much, Senator. Are there any questions from the committee? Nope. All right. Or is there anybody here to speak in support of this bill?
Madam Chair, members of the committee, Emily Moore with Voices for Virginia's Children. We thank Senator Hashmi for her very important work to bring access to people where they need it in their communities. So we ask that you support the bill as well. Thank you.
Thank you. Is there anybody here to speak in opposition to Senate Bill 250? All right. I don't see anybody. The senator is correct. This bill does not need to be referred to appropriations, and maybe it sounds like because it's currently a service already, we want to make sure that it's codified.
Madam Chair, move to report.
Second.
All right, we have a motion to report that's been properly seconded to a motion to report Senate Bill 250 that's been properly seconded. Madam Clerk, if you can open the roll. Please vote. All right, please close the roll. This bill passes our subcommittee by a vote of 7-0. Thank you so much, Senator Hashmi.
Thank you, Madam Chair.
All right, and then I should have started with our administrative items. I've let Senator McDougall know that we're going to take by for the day Senate Bill 683 on the Family Children's Trust Fund, and we will hear that at a future subcommittee meeting. So that concludes our quick work for our subcommittee today. Thank you so much, and we stand adjourned.